going to do your head to toe assessment today. I'm going to wash my hands, and then can you tell me your name and date of birth?
Annika Bishop, 5/24/99.
Okay, to start with, I'm going to give you 4 words, and I need you to repeat them back to me at different intervals during the assessment. So they are doll, water, radio, and fan.
Doll, water, radio, fan.
Okay, I already took your vitals and went over a general assessment. Yeah. Looking at your head is normocephalic, it's midline. Your hair is evenly distributed. I'm going to palpate your temporal artery, and that is smooth and even. And then I'm going to put my hands on your jaw and have you open and close. Okay, good. The temporal mandibular joint is smooth, even without crepitation. I'm going to touch your sinuses. You tell me if there's any pain. The frontal sinus, anything?
No pain.
Okay, maxilla.
No pain.
Okay, good. Now, looking at your eyes, your eyelashes and eyebrows are evenly distributed, symmetric. Sclera is white, glossy, cornea is clear. Can you pull down your lower eyelids? Okay, good. Conjunctiva is pink. Now I'm going to shine this in your eyes. Or no, I'm going to have you read first, actually. Could you read this for me?
It says hello.
Okay, it says hello. And now I'm going to shine this in your eyes and check for the corneal light reflex. Okay, I can see the bright white light in both cornea, so the reflex is there. Normally I would dim the lights to check for the pupillary reflex, but I can't right now, so let's do it here. Okay, and the pupils constrict bilaterally. Now can you follow this with your eyes? Okay, good. The eyes converge and pupils constrict. Now keep following this with your eyes up with your head. Okay, good. Cranial nerves 3, 4, and 6 are intact. Can you pull your mask down for me? Can you raise your eyebrows up? Puff your cheeks out? And then show me your teeth. Okay, good. Cranial nerve 7 is intact. Now can you tell me the 4 words again?
Doll, water, radio, fan.
Okay, good. Now looking at her ears, they are symmetric, even color. Is there any pain if I touch on your auricle or tragus?
No. No pain.
Okay, good. Now I'm going to come around behind you and I'll whisper 3 letters or numbers on each side of your ear. You tell me what you hear.
1, 2, 3. 4, 5, 6.
Okay, good. Cranial nerve 8 is intact. Okay. Now looking at your neck is midline, straight, and erect. I'm going to feel your carotid, and they are smooth and even. Trachea is midline. Now I'll listen to your carotid arteries with the bell, and I would listen under the jaw, mid-cervical, and at the base. And there's no bruise present. Can you lower your mask and look at your nose? Okay, good. Your nose is midline in the face. It's proportionate. Can you plug one side? Breathe in and out. Okay. Okay. Patency is good. And then go ahead and close your eyes. I'm gonna put something in your nose, and you tell me what the smell is. Okay. Okay, good. Cranial nerve 1 is intact. And then your lips are a darker pink than the rest of your skin. Can you show me your teeth? Okay, good. Teeth are straight, white, without debris. Gums are pink and in contact with your teeth. Can you stick your tongue straight out? Okay, good. Tongue sticks out midline without tremor. Cranial nerve 12 is intact. And then I'm going to look inside your mouth. Buccal mucosa is pink and moist. Open again. Okay, I can see the soft palate, hard palate with the transverse rugae. And then then I would like you to stick your tongue out and say ah. Okay, good. Uvula raises midline. That's cranial nerve 10 is intact. Tonsils are a +2. Normally I would check the gag reflex, but I'm not going to right now. If I did, that would be cranial nerve 9. Now I'm going to put my hands on your shoulders and have you raise against resistance. Okay, good. Cranial nerve 11 is intact. And then can I see your arms? Okay, good. They are symmetric. No edema, warm. Okay, capillary refill is good. Less than 3 seconds. Can you grab? Okay, good. And then I'm going to come around and listen to your back. Okay, upon inspection, her back is straight, downward sloping ribs. And then I'm going to put my hands on your back and have you take a deep breath. Okay. Okay, chest expansion is equal. Spine is straight. And then I'm going to put the sides of my hands on your back and you say 99 every time I move my hands down, okay?
99.
Okay, good. Tactile fremitus is even. And then I would listen with my diaphragm for the 9 breath sounds for 1 full inhalation, exhalation. I start 1, 2, 3, 4, 5, 6, 7, 8, 9, and 9. And the breath sounds are equal, clear, without any adventitious sounds. And yeah, I'll go around the front. Okay. Now I'm gonna check your breast movement. Can you put your arms straight up? Good. And then hands on your hips and push in. Hands in front of you and then push in. Okay, good. There was no retraction or lag. If there was, I would move on to palpating. Can you tell me the 4 words again?
Gall, water, radio, fan.
Okay, good. Now go ahead and lay down.
Alrighty, so now I'm going to assess your upper extremities through your arms.
Okay.
And look at your
And then
arms.
look away from me.
Hair and even color, no lesions.
Um,
I'm going to ask you to squeeze.
Oh, you know what? Before we do this, when you sit back up, I need to listen to the front of you. Okay. Sorry. Okay, so looking at the anterior chest, her respiration's about 16. It's unlabored.
And now.
And then I'll listen to the anterior chest, the breath sounds starting above the clavicle. 1, 2, 3, 4, and then 5, and they would be clear. Bilateral, no adventitious sounds, and then I'll check skin turgor for tint, and there's no tenting. Okay, now you can lay down. Okay, then go ahead and look away from me. Okay, I'm looking for her jugular vein, which is about there. I'm gonna move this up for a minute. And then I'm gonna raise the head to 45 degrees, and I should watch the jugular vein disappear. Okay, good, and it disappeared. So now I'm gonna lower it back down.
So start at the fifth intercostal.
Oh, there's good. Okay. Now, looking at the chest, there's no heave or lift. Then I would feel for the apical pulse, which I can't feel on her, but that's normal. So then I go to listening with the diaphragm at the 5th intercostal, mid-clavicular at the mitral valve, and then, or I would listen to that for a full minute for rate and rhythm. Then I would listen for murmurs at the mitral valve, at the 4th intercostal, at the tricuspid, 3rd intercostal, Erb's point, second intercostal, right at aortic, and then the second intercostal left at pulmonic. And then I'll turn this around and listen with my bell at the same or at the same locations: pulmonic, aortic, Erb's point, tricuspid, and mitral for any bruits, and there are no bruits.
So with the abdomen,
I'll lift. Can you lift your shirt up? Okay. For her abdomen, I don't see any pulsations. There's even coloring. It's flat. Demeanor is relaxed. The umbilical is midline, and there's no discoloration or pulsations there either. And then I will start with listening with the diaphragm at the lower right quadrant for vowel sounds, and I listen for a full minute or until I hear 5 to 30. So I'll start, and if I don't hear 5 to 30 in a minute, I can go up to the upper right, upper left, and lower left. And then I will turn to the bell and listen to vascular sounds at the aortic, renal arteries, iliac arteries, sorry, and then femoral arteries. For any bruits, there are no bruits present. Now I will palpate, starting at the lower right with 4 fingers for any pain or masses. Any pain? No. There. And then to the left, upper left, and then lower left. No pain? Okay, good. You can go ahead and play your Okay. Now for the genital urinary, do you have any pain, itching, burning, problems going to the bathroom? Okay, perfect. For her legs, her legs are normal color, even color, symmetric. There is no edema. The skin is warm, dry. I will feel the posterior tibial pulses, pedis dorsalis, and then the popliteal. Feel for all those. They would be +2. And then can you push down on my hands? Okay, good. And I will check capillary refill, and those are less than 3 seconds. Let me get this, and I'll check your what is it? Pedal reflex. Okay, and then go up. Okay, her toes don't move, which is normal. If they were to flare out, that would be a positive Babinski, and you do not want that. Okay, go ahead and sit up. Oh, let me flatten this a bit more, sorry. Okay. I should have had it flat when I was listening to her abdomen. Okay, next I will test her reflexes. And then, good. Okay, good. So her reflexes are good. If they were absent, I would go in, test her other reflexes as well. Okay, for the next 4, I would like you to close your eyes, and I'm going to start with a cotton ball, and I will touch your face, arms, hands, legs, and feet, and you tell me where. Okay, good. And then let me see your hand. Okay, I'm going to move one of your fingers. You tell me which finger I'm moving. Okay, good. And I'm going to draw a number in your hand. You tell me what it is.
3.
Okay, good. And then here's something. You tell me what that is. Okay, very good. Now you can go ahead and open your eyes. Now next, I would like you to use your fingers and touch your nose rapidly. Okay, good. And then with your hands. Okay, very good. Then put your heel down your shin. Okay, good. Backtracking a little, I just remembered I forgot to do your range of motion for your neck. So I'd like you to look down, look up, look over your shoulder, and then ear to shoulder on both sides. Okay, good. Okay, I think last I will have you stand up and then put your feet together and close your eyes. So this is the Rumber test. It's test for cerebellar ataxia. I wouldn't do this with someone with MS or who's intoxicated. And I do this for 20 seconds. Okay, go ahead and sit down. So that we should know, there's some swaying's normal, but she shouldn't lose balance. Now, can you tell me the 4 words again?
Doll, water, radio, fan.
Good, okay. There are no other indications for further assessment for neurological or musculoskeletal. Do you have any questions?
I do not.
Okay, then I'm all done. Thank you for your time. Wash my hands and I'll leave.